So you've just started medical school. You can be right at the beginning, you can be in the first few months, but these are some lessons that I know you have to hear because I get you at the end of the second year and there's all sorts of problems for me. And the first starts with this. The way you've learned to this point is not going to work anymore. It's just not. All of us go through this. We got into med school. We're convinced we know how to study. There's too much to learn. It's coming too fast, and if you try to use those old methods, you're just going to start memorizing, and it's not going to serve you well because you have to bear in mind this truth. You are training to be a doctor. One of the hardest things to make the mental shift on is you are no longer trying to pass exams. I get it. You do have to pass exams. When a student comes to me and says, I want to learn, my first question to them is this. Are you passing your school's exams or not? Because if you're not passing your school's exam, that's a different problem. We're going to get you through the exams. But if you're passing those school's exams, you have a very different problem. Your challenge now is, am I getting ready for patient care? So let's just start with that in mind. Every time you think you're studying for exam, hear my voice. No, you're not. You're getting ready for patient care. The old methods don't prepare you for that. In this video, we're going to talk about how you're going to learn in medicine, and you're going to do that by using medicine to learn how to learn. Every week, I'm posting here a new video on medical education, both for students and educators. Sometimes we talk about how to study more effectively. I often use clinical reasoning as a way of just learning how to reason, but also how to learn medicine by doing that. And if that's the kind of doctor you want to become, be sure to subscribe. Hello, I'm Dr. Philip Tisdall. I went to medical school 50 years ago, practiced 40 years, and have been teaching medical students for over a decade now. So let's talk about using medicine to learn how to learn medicine. Let's just stop and think about that. As you're in your first year medicine, you've got a vast amount of content to learn. Let's use that content so that after you've mastered it, everything else is going to be the same. Let's talk about what I mean by that. Here's a classic example going from undergrad to medical school. You've been very good at hearing an idea and summarizing it. Yeah, I get it. That worked for you. It's not a good idea anymore. Now, because you're getting ready for medicine, what you should say is this. I read that subject. What question can I ask that demonstrates I know this material? Questions, not summaries. What's another idea? You've done everything through multiple choice questions. Here's the problem with multiple choice questions. They're designed for your administration. They're practical, easy, and you can computer grade them. Medicine doesn't work like that. You're going to be presenting a patient, and you're going to have a way of thinking about it that's based on recall. So you've got to stop from a recognition of multiple choice questions to recall. And the way we do that here is if you can't draw it, you don't know it. See me looking up in my mind's eye? That's recall. It's not looking at 5 choices and going, well, I can eliminate 3 of them. That's not medicine. That's multiple choice exams. That's undergrad. You want to learn by having models of how to think about things, not by having lists. That's my biggest objection to tools like Sketchy. Yes, we have to do some memorizing. Sorry, I get it. You yell at me all the time when I say you don't have to memorize. You're right. You do have to memorize micro. You do have to memorize some pharm. But when you come to pathophys, which is really the core of medical reasoning, you need models. Let me give you an example. Let's talk about edema. Now, if you're an undergrad, you'd make a list. The factors in edema are hydrostatic pressure, oncotic pressure, leakiness of the vessel, and the lymph. But that's not what I would teach you. I would say, so here's a picture of a vessel. Let's draw Starling's forces. See the hydrostatic pressure out, oncotic pressure bringing it back in, and the amount that goes out depends on leakiness. There's a net drift out, and that's picked up by the lymphatics. It's not a list. It's a way of thinking about a process. Much stickier. It's got a picture. That's just better. I promise you, I'm going to use it when I teach you. The single best way to learn an organ is to reverse bioengineer it. Ask yourself, why do we have it? So example, it's not just what does the heart do? You should ask, why do we have a heart? And the answer is we have a heart because in evolution, we have specialized out all of these functions so that, for example, oxygen in and oxygen out might be 3 feet away from the cell that's using it. And when you re-engineer by design, even if you haven't learned a fact, you can guess what the answer must be. Here's an example. Literally just 20 minutes ago, I was talking to a student that has been struggling, and now she's with us. And she was talking about an exam question in which she wasn't quite sure the answer. Here was the exam question. The question was the problem of diarrhea, but all of the symptoms and information suggested hyperthyroid, and she just didn't know. And so what I said to her was, well, sure, because you and I have not talked about how do you think about the thyroid? And so when you say, give me a way of thinking about it, you know how you think about the thyroid? I'm not kidding. This is how I think about it. Go back and find out when it occurred in evolution. Because evolution first appears with the notochords because it is the signal for developing of the nervous system. Yeah, if you know that children who have agenesis of thyroid, I bet most of their problems are neurologic. Yes, they're cretins. Similarly, the next time you see a big shift of thyroid in evolution is when we become warm-bodied. And now we get into this long discussion of temperature regulation, which ends up with how we regulate our temperature, which is the sympathetic nervous system. So when I say to you, do you think thyroid disease is really closely connected to the sympathetic nervous system? You're going to say, well, yeah, I know that story. Yes, it is. What do you think increased sympathetic tone does to the peristalsis in your colon? So you don't have to know that diarrhea is from hyperthyroid if you know that hyperthyroid is related to sympathetic tone. You can just figure it out. And that's how we take these ideas of reverse bioengineering, and we can have this core understanding that is easier than just to remember a bunch of facts. The next discussion has to be how your school is organized. There's 2 basic ways the basic sciences are organized. The traditional way is first year of med school is normal. Second year, you pick up all the abnormal and clinical information. Of course, we all recognize the problem. You study anatomy, you come to me in pathology. It was a year ago, you haven't got anything. That's a problem. The easier way to remember it is we do it by systems. You're still going to have anatomists coming in and do anatomy, but it really lends itself to how clinicians think of it. So let's just get that second one out of the way. If you're learning in a school that has systems processes, then as you start each system, just read the clinical pathophys book, because that tells you what you've got to know. You can learn more. There's always more to learn, but you've got to know that. Then when you go to class, that's just your extra stuff you're going to get tested on locally. You know what you need for patient care and national exams. What do we do if you are subject-based learning? Well, that's a lot harder. And what I'm going to suggest to you is you've got to start learning in a structure-function relationship. I get it. It's not easy because you have anatomy, which is structure, and physiology, which is function, and they're 2 different classes. You can certainly use the book for this because obviously pathology is based on structure-function relationships. But let's just talk about some examples. You've got to start organizing every system into common principles. So what are some principles? Well, for example, you've got to talk about the biomachine concept of homeostasis. Every system is regulated. It has a dynamic range, monitors, controllers, and effectors. That's a really important way of organizing your information. Clearly, this is chapter 1 in the book. Another example is you've got to be able to talk about, in physiology, 80% of physiology, and I'm not making this up, is gradients. So if you master the concept of gradients, well, you recognize, well, gradients, there are pressure gradients, there's osmolality concentration gradients, there's electrical charge gradients. Boy, once you recognize phys as gradients, you kind of broken the back of it. So that's a good example of a principle. When you go to biochemistry, you're going to start talking a lot about energy. Organize it by energy so as you're learning all the ways we make it and consume it, you understand you've got to power the machine. Another example of principles is cell cycling really learns well in neoplasia. So we'll get to that in pathology, but if you can start thinking about abnormalities of cell cycling in neoplasia, it will make really good sense why you're learning it. The system all has to be integrated. So another great way of organizing as a principle, no matter what anatomy or system you're in, is to say, how is the communication done? So that's why this huge phrase, neurohormonal, I spend endless hours teaching it, even though everyone's done the physiology multiple times. When you start teaching it as this is a regulatory control information system, it just makes way better sense when I say, how does the body monitor tissue perfusion? How does it do that? And the answer is, it doesn't. It just monitors blood pressure. Well, great. How does it then signal? Now we're into all of our discussions of cranial nerve afferents, nucleus tractus solitarius, all the way down to the autonomic nervous system. So think about, how does the system communicate and regulate itself? That's a great system word. Anytime you see the word system, that tells you it's a holistic way of viewing it. And that's a really good thing for you to learn by. When you've thought through the principles of structure function, without a doubt, that's the single greatest way to make them matter is to move on to basically your pathology principles. There's no point in learning normal if you don't know what happens and how it breaks. So that flips, right? If I'm going to break something, it means you know how it works. So as soon as you can, take your structure function into pathophysiology. So, what are some of the great words of this? When you start doing this, you get into the world of injury, stress, and adaptation. Every organ system has this. That's what the word chronic means. When you say the word chronic, then immediately you say to yourself, I better put everything on a timeline. Adding time into your pathology just changes everything. It's just a great way of organizing how you think about it. You've got to do inflammation and repair. Every system has inflammation. Why is it that all the students that come to me in second year, if I ask them this basic question, what cell is the center of the innate immune system? Yeah, no students ever answered that correctly. The answer is, when I say innate immunity, you're saying to me neutrophil on target. In every system we come to, there's an acute inflammatory process, and you should say, how do I get the neutrophil on target? And when you do that, now all of a sudden, you're asking a good question. You're not actually making a summary. That's a really good way to learn. Hemodynamics. Oh, man, we're back to gradients again, aren't we? Hemodynamics is about pressures, hypoxia, stenosis, regional, systemic. Boy, when you can do hemodynamics, you've mastered a big chunk of the pathology of every organ system. And then we're back to cell cycles and neoplasia. Cell cycles just aren't terribly relevant in medicine until you get to neoplasia, and then that's all we talk about. So, we have come to the point now where we're saying, as you're learning this, there are two really big ideas. Do structure function the right way, do injury pathology the right way. Let's just finish up on a personal note. As you're using medicine to learn, you should be studying yourself personally as a learner. We all have different biorhythms. You should be very familiar when the best part of your day occurs. I'm an early morning person. When I have to do high cognitive functioning, meaning I'm starting a new subject, I'm going to sit down with my clinical notes, with my lecture, and with my trusted resources, include and what not to include. And I'm going to do that at the best time of day for me, which is first thing in the morning. If I have to go to class, then I do it at the next best time for me, which is right after dinner, because I fade at 9:30. If you're a night owl, that's not true. You'll wait till everyone goes to bed, and then you'll be quietly up late at night because that's your best time. So study yourself as a student. You need to have a routine. I talk a lot about blanking out your background. And you learn this in microscopy. If you're on your microscope that you've sat at for years, when you sit down and look down the lenses, you're completely unaware of the room. The chair is the right height, the width is right, the rotation is right for your left hand. When I sit down in someone's new microscope, I'm aware of everything. Kind of crooked neck, kind of sitting awkwardly. It's just not the same. Have a place you study that you will not be interrupted, and blank out your background. That's part of your physical environmental routine. I had one student that had a lot of kids, and it was very, very difficult to him to get away. So we built in his basement a little soundproof box. And he would go to this unfinished basement. He'd go down the stairs and he would be in his soundproof box. And that's how he created his routine, in which he had 3 hours to study. He had 2 hours and 58 minutes of it with good mental action. So learn yourself, pick your rhythm, get a routine, blank out your physical space, and then differentiate how you learn as an individual versus how you learn as a group. Because I believe that when you first are learning something, that's a private individual moment. But when you've done that and you really have not got your freshest mental performance, go get your group. See if you can explain it to them. Ask them what they did. See if you believe it. It's really a good way for your second tier learning is to do it in a group and talk. Talking is not the mental intensity of learning, and it's a really good way to practice in a new context. The last thing I want to conclude with is this. You have to learn to ask for help. Don't come to me when you failed 2 exams and in 48 hours you're facing a repeat of the year. Don't do that. The second you're confused, the second you feel you're getting behind, the second you're unclear on a subject, ask for help. And remember, there are 3 really great resources, whether you know it or not. Every school has them. And I'm not kidding. I would start with the library. Those librarians are so great, and they're these sad, lonely people no one ever asks them anything. They're unbelievable resources. I mean, you're looking at the guiltiest party in the world here. I'm in my med school. I'm learning how fantastic they are, and I'm kind of embarrassed that I've never used them before. So you can avoid my mistake. Go talk to your librarian. They are the best for resources. Every school also has academic success officers. I get it. Some of them are pretty ordinary, but if you get a good one, they know everything. I mean, Kate in my school is just fantastic. Kate and I talk about you guys all the time. I will ping her that a student contacted me. She will ping me back whether she's seen the student or not. And we plan when she thinks the student doesn't have good content, she sends them to me. If I think it's more psychosocial cultural, Kate's going to be way better than me. And she's got a whole department. She just happens to be the one I know. Your medical school has this department. Use these people. They are really terrific, and they are there to help you. And then the last thing is learn how to use your faculty. I know you feel awkward approaching them. Go and do it enough in person that you develop a relationship. I have students that I still follow on Facebook that I taught 10 years ago. If you like teaching, you like your students. We don't do it for the money. You can imagine that. We do it because we actually get intense gratification watching your success. So learn how to use your faculty. They're not all equal, so go try them all. And the ones that are most helpful, develop a professional relationship with them. I know that sounds awkward, but you're transitioning from being a student with a professor to being a junior colleague with a senior colleague. Trust me, it's a really different relationship. So let's finish up here. 2 big ideas. What worked before won't work now. Use the learning experience to learn how to learn. Be ruthless with yourself. Go to structure function principles. Use pathology to teach yourself how normal works, because that's what you're breaking. And then last, study yourself personally. Get your biorhythm right. Get a proper physical space, and not least, ask for help. There's no substitute for tutoring. If you'd like to learn medicine this way, we have 2 resources that can help you. The first is we have our core Pathophysiology textbook. And the second is we're going live with our community. You can come and meet me live. You can come and access our videos. You can come and meet peers. We're really looking to engage people that have an open-minded enjoyment of education and want to be helped and want to be taught. For more information, click the links in the description. See you next time.